Hello, welcome back to the live. So, like I said, if you were at the last live, yes, I got the same thing on, but y'all gonna see that live anyway, because I washed my clothes. But anyway, so yeah, so I'm doing kind of a marathon today. So, if you were at the live, if you were at the live on March 28th, that was the beginning of the marathon, and I posted that live, and now I'm still live March 28th, pre recorded, but I get to join you. So it's not going to be weird that you'll also see me making comments and responding to you in real time when you're watching this live whenever I decide to post it. All right, so today we're going to talk about therapy. So we started the discussion last time about, give me a second. We started this discussion last time about like how to get help or where to find help, and now we're going to start getting into the nitty gritty about what that help looks like. So let's get started. I need to talk to somebody. This will be a discussion about starting therapy. So let's first talk about when you should consider starting therapy in general. So there's when you're feeling stuck, like you're like, I feel kind of stagnant in life. I kind of need some help navigating where or what I should do now or next. There's also if you have a diagnosed condition that is known to be treated with therapy, which is most, if not all, mental health conditions. Moreover, you should start therapy if medications alone aren't helping. And for a lot of our diagnoses, the treatment of choice is both medications and therapies combined. You need skills to cope with whatever you're dealing with. This could be with or without a diagnosed condition, or there has been some type of trauma. And we talked about this in a previous lecture. There could be big T traumas, and this isn't to negate or say one trauma is worse than the next, but it could be big T traumas like sexual assault, rape, violence, war crimes, domestic violence, and there could also be kind of those what we call little t or what I call little t traumas, which are those things that build up over time into a huge traumatic experience. So this can be repeated. So these, and then there, so let me just start over. And then, and then there could be little t traumas, which aren't necessarily a small thing, but things over time that could build up and accumulate into a big trauma in itself. So this could be racism over time, sexism over time, just things that keep coming and coming over time till it has that cumulative effect on that person. Another time to consider therapy that isn't on this lecture slide is when things are going well. Things are going well. So you're like, what? Yes. For a lot of people, therapy is best when things are going well. Why? Because A, they're better able to even participate in therapy, they're open minded, they're clear headed. But B, this is a great time to gain the skills needed for when things aren't well. So sometimes I tell people, just to sum it up, when things are well, that's great for skill building. Sometimes you just need therapy for maintenance. And then also therapy can be when you have those acute or those like bam came out of nowhere moments in life where you need some therapy to get through it. So there's different people that do therapy. Like when you hear I have a therapist, that can mean a lot of things. Therapists can be social workers. Therapists can be psychologists. Therapists can be psychiatrists. And then there are other mental health specialists. So social workers can, I think, they at least have a bachelor's in social work. I think so. At least a bachelor's, and then that can go all the way up to a doctorate in social work. So there are some social workers that are doctors, but this is like a doctor of philosophy or a doctor of social work versus a medical doctor. Then there are psychologists. These are doctors. These are doctors of psychology. They got a doctorate degree in psychology, right? And then that's kind of the highest level of that's the highest, I guess, graduate level is a psychologist. And then there are psychiatrists. Psychiatrists are actually medical doctors that specialize or did their residency in psychiatry. They can do medication management and also therapy. And then we have other mental health specialists, which can include nurse practitioners, and they can also be up to a nurse, but some people even have a doctorate in nursing. But nurse practitioners, physician assistants, even mental health counselors is a bachelor's degree. So someone could say, I have a therapist, but the level of training or how they were trained can vary widely. I do want to note, although a life coach can have its place, especially when it comes to executive functioning, a life coach is not a therapist. They're not a therapist. So just keep that in mind. If you are doing some type of coaching, it's called coaching specifically for that reason. They aren't trained to be a therapist, if that's what you're looking for. So, mediums, what are the different ways in which you can see a therapist? You can see them in person, you can see them virtually, and there's even some platforms that have it where you only text your therapist or text the provider, and that's the only mode of conduct. That's the only mode of contact. I would say when it comes to the medium, it of course is like comfortability, but sometimes some would be better than others. So I would say in person is like the highest level of care, like you need the most, and texting is like very minimal. It's not an emergency or a crisis type situation that you're finding therapy for. I would also recommend in person when you're doing like some type of procedural type therapy. In person might be helpful, but speak to the provider because sometimes therapists can do things that we normally think to be an in person therapy, they could do it virtually. So speak with them, see how they do it. But I would say if you're going through a crisis, the only one I would really try to avoid would be the texting one. So, what happens during this first act interaction with the therapist, or what could happen? So, the first thing I want to put out straight out from the beginning with that first interaction. I know you don't know them yet. I know you don't have rapport, but from the beginning, you're gonna need to be honest. Another thing is that rapport does matter. So even before we get to the questionnaire, phone interview, initial evaluation, you've kind of already not selected, but thought about who you would like. And I would say, unlike medication management, even with medication management, this could be a factor. The demographics and the lifestyle of the therapist may be a huge factor on who you pick, even before we even get to the questionnaire part. So you may want someone that you can relate to or that you feel may understand you. I feel like even though we're all trained to an extent within our specialties and within our degrees, that is going to be a big determining factor. You need to be able to say, no matter how this person is trained, I feel like I'm going to feel comfortable with them. Because the main determinant of the effectiveness of any therapy is rapport. And rapport is how well you can get along with your therapist. For better lack of words, how much can you buy what they're selling? That is the main thing, that you are able to form a relationship with this person. So let's talk about what the questionnaire entails. The questionnaire is usually like a quick engagement with the provider. It might have like a rating scale or you saying something about what symptoms you have. This might happen anywhere in the process, a questionnaire. Then there's also a phone interview. So some people will go straight up and say, hey, you can schedule the initial interview. Please fill out this questionnaire first. Or some people say, oh, I want to do a phone interview first before the initial evaluation. Don't shy away from the phone interview. I know a lot of people are like, I don't want to go through all that. Let me just get the initial evaluation. I think the phone interview is invaluable because it kind of prevents both of you from wasting each other's time. Like when you're on the phone, they hear minimally about what's going on and what you want. They can tell you about their practice, and you can see even before you've gone through a whole hour to an hour and a half long evaluation whether or not this is a good fit. This also goes with medication management or getting medications. You might have some type of questionnaire, a phone interview, and then an initial evaluation. Don't shy away from the phone interview. So during that phone interview, you want to know if the provider is a good fit. So they'll ask you, or they should be asking you, what you're looking for. They'll ask you they may ask you whether you had past suicide attempts or self harm. If you use any substances, have you been hospitalized? This isn't just to like right out the gate exclude you from treatment, but for the most part, it's to see if you're appropriate for that practice. And then you should ask them about their approach, especially if it's a therapist. Are you skills based? Is it talk therapy? What type of therapy do you provide? Is this going to be more formal? Is it informal? That type of thing. We'll talk about types of therapy later in the course, or types of the types going through some of the common types of therapy you will see. So don't worry about that too much, but it is something to think about. Just asking them, what type of therapy do you provide? Is it talk therapy, or do you do some type of skill based method? And then last but not least is the initial evaluation. Now this can range in thoroughness. I like to think of myself as being very thorough, and I would prefer that you find a provider that's very thorough, but it can range. It can also range from not just thoroughness, but also length and how many sessions. Some people will do the evaluation and it takes like one session. Someone will say, I split it into two, and some will say, well, I kind of have a getting to know you period, and we just count that as the evaluation period. So, evaluations can range in thoroughness, in which you'll go over the diagnosis you had in the past, what type of symptoms you're having now, family history, substance abuse history, social history, medication history. They'll go through a lot of things. So just be prepared when you're going to do any about evaluation. If you used to take medications in the past, if you used to do any therapy in the past, it would be very helpful if you knew what those things were. You don't have to, it's not required, but it does help the process go along a lot quicker. Now, before starting therapy, you may or may not get an informed consent. I would say if you don't, you could even ask them. So, informed consent is essentially you agree to something after knowing what's the point of it, so the uses, what are the benefits of it, what are the risks, and what are the alternatives. This is something that is kind of commonplace with medications, and you can kind of see how that could be straightforward if you're starting a medication. But this also goes with therapy. Like, ask them, like, what is this therapy used for normally? What are the benefits? What are the risks? There are risks to therapy. All therapies have risks. Ask them, what are the risks specifically to this type of therapy, or the risks to therapy in general? Because there are risks to therapy. Just to name a few, it can bring up feelings that you haven't felt in a while. It can sometimes even make people have more nightmares or different dreams or what have you. It's not a static thing, and I'm not saying like this will happen to everybody, but it's worth talking to your provider before you do therapy. What are the risks? That's saying if they tell you there's no risk to therapy, I don't know about that. There are risks to therapy. And then alternatives. Okay, let's say I don't want to do this type of therapy. What other therapy modalities, as we call them, therapy types do you do or you suggest that could also be helpful to me? Especially after they did the evaluation, they should have a good idea of like what other things could help you. And then while in treatment, I want you to remember this because it is so important. You are not stuck. Yes, you found the therapist. Yes, they look like the person that you want, and it seems like they have the values that you want. Yes, you did the phone interview and y'all meshed so well. And yes, y'all did the evaluation. And yes, y'all did about 10 sessions and it's great. And when it's not, guess what? It's not. Is it not a good fit? If it is a good fit, feel comfortable because this is about you. Therapy is about you. It's not about me. It's not about my paycheck. It's not about how I feel. It's not about anything. Of course, I want you to be considerate of someone's feelings. Yes. But this therapy is you. It is you driven. The point of this therapy, the point of you coming to see this therapist is for you to get better and for you to cope and for you to get the skills you need and for you to break through that trauma and for you to be better and for you to be well. So I want to give you the confidence if you're seeing this and you have a therapist that you feel stagnant with, or you think that you're the type of person that you just naturally stay in relationships that you shouldn't, remind yourself, I am not stuck. So throughout the therapy, think about, is this still a good fit? If you're not really getting much from the therapy, if you feel like you're not really getting better and you feel like you could, talk to your therapist. We are trained to handle that. We are trained to have these conversations with our patients where they're like, I don't know if this is working for me. Talk to us. We are trained to work through that with you, whether it be us saying, okay, maybe I could help you with resources, find someone else, or it could be, okay, what about this isn't working? Maybe I could try something else that will help. But voice your concerns if you feel like the fit is no longer good. If you don't feel heard, if they're talking too much, if when you do talk, it seems like they don't understand, if for whatever reason you don't feel heard, might be time to leave. And for the least, express yourself. You're not stuck. And are you in the right modality? CBT and other modalities that are skills based where you get homework might be too much. You never do the homework. Is this the right modality for you? You find yourself, I want to talk. I need to vent. Maybe skills aren't the best, or I don't want to vent. I want skills. Maybe CBT or some modality or type that is skill based is better for you. Don't ever feel stuck in treatment. Remember, the treatment is for you. The treatment is for you. So I just want to leave you with some highlights that with therapy, it can range. The type of provider can range, the training can range, the the style can range. So when someone says they have a therapist, that can mean anything. Even within the specialties, there are levels to it. But the main thing is whether or not you have rapport or you get along with that therapist. For better lack of words, you're buying what they are selling, that you believe in yourself and you're edified through that relationship in some way. And some people, there's different types of therapy where that doesn't happen at all, but you're mostly just, you got to work through the process. You're just talking. And sometimes that may not be the right therapy for you. But whatever it is, to the last point, know that you are not stuck. Know that you aren't stuck. When you don't feel right about the therapy, always think to yourself, is this a good fit? Do I feel heard? Is this the right modality? Should we try something else? And don't keep this as an internal conversation. Don't keep this as an internal conversation. Talk to your therapist. They are trained or should be trained to handle that is not working. All right, so good luck. Thank you for joining this talk about therapy and what to expect while you're in therapy. Like I said, this is pre-recorded, so if you, oh, let's see if you can see me bigger. I'm gonna make me big now. Don't forget this is pre-recorded, so if you have any comments, put it down. I'll see it in real time, and I'll comment in real time. It's gonna be real cool. And then not only that, even if you miss the record the live stream of the pre-recorded, it'll still have, you know what I mean. It'll still be there, so still put on comments. I'll still see them in retrospect and can comment whenever I can. And don't forget, there are multiple ways to support this channel and this content. Like, subscribe, notifications, always great. At this point, we have 100 subscribers. I want to have even more so I can grow this channel, grow the content. Then I have a Patreon. I'm excited about this Patreon. I just got it started. So if you're one of the first people to join, it is a steal. I'm telling you, it is a steal. Because at some point, the value of all of these lectures combined, edited, without the fluff, is going to be it's going to be worth it to join now and get that price locked in. And then not only that, the Patreon will have the same thing as the Udemy courses. And the Udemy courses are like, maybe I don't want to support on a monthly basis, but I just want that course. And this course will be edited and put on my existing course. So it's like you get double the content. You get the 2026 and the old version whenever I recorded it. So there's plenty of ways to support the channel, but I just like to thank you for this view right now. Thank you for being here. I hope you have a marvelous day, a wonderful day, and I'll see you next time. Bye.